Hospitals gave patients meds during childbirth, then reported them for illicit drug use. It doesn't get much more egregious than that, okay? So I'm going to scroll all the way down, right? Because I just want to talk about the parts I felt it's a very long article. So I'm just going to go to the points that I felt was most important to us as Black people, okay? The risk giving medications to birthing patients and testing them for illicit substances have been well documented. A 2022 study by researchers at Massachusetts General Hospital found that 91% of women given fentanyl in their epidurals tested positive for it afterwards. Other studies have found that mothers can quickly pass these medications onto their babies. A baby's positive drug test cannot and should not be used to identify fentanyl drug use in drug abuse in mothers, said Althea Padres. And Althea Padres, the lead researcher of one of the studies at Brigham and Women's Hospital in Boston. Despite these warnings, hospitals often lack policies requiring providers to review a patient's records to see what medications they received before reporting them to authorities. Now, I want you to keep in mind how they snatch Black babies away from their parents. And we have seen, if we remember that case, as a matter of fact, there's the Hearts on Hulu is about a family of children who was taken away from their grandmother because the mother came to visit, and they were given to two lesbian women who kept moving them around every time the teachers would put in child neglect cases with authorities. When they would report them to authorities, they kept moving around. Then after that, after they kept moving around, they decided, okay, instead of doing that, let's homeschool these kids. And then they homeschooled the kids and continue to abuse them, not feed them, sell them. And then after the authorities finally started to catch up with them, because one of the kids, I think, jumped out the window and ran to the next house. When they finally decided to apprehend them, the two lesbian women put the kids in the car and drove off a cliff with them in the backseat. So think about that as you think about how they are pulling children from families, and now they are giving you the drugs to make you test positive on. So when you're in the hospital and they're just putting things in your IV, you don't even know what they're giving you. They received before reporting to authorities. Mandatory reporting laws protect doctors from liability for reports made in good faith, which means they could just do whatever they want to do and have no consequences, even if they turn out to be wrong. What kind of consequences are you subjecting these children to when you are falsely reporting their mothers for drug abuse? And toxicologists and doctors say many doctors lack the time and expertise needed to adequately interpret drug test results. So wait, the doctors? Wait, let me read that again, okay? And toxicologists and doctors say many doctors, not nurses aides, many doctors lack the time and expertise. And in addition to, so it's not just they don't have the time. Even if they had the time, they lack the expertise needed to adequately interpret drug test results. How scary is that? Family. It's not something routinely taught in medical school or even residency, said Dr. Tricia Wright, an OBGYN and professor at University of California, San Francisco Medical Center, who specializes in substance and disorders in pregnancy. It's all up to the individuals who make their own interpretations. This is, anytime something can be left like that, it's bad for us. Because we are never given the benefit of the doubt. It's all up to individuals who make their own interpretations. Wright helped change the policy at her hospital, one of the country's leading teaching facilities, to direct doctors not to drug test patients unless medically necessary. While drug tests can help pediatricians determine how to treat an infant who may experience withdrawal symptoms, many OBGYNs say that positive drug test results do not generally inform the mother's medical care, so they have little reason to dwell on them. Instead, at many hospitals, it is social workers responsible for contacting child welfare agencies who are more likely to pay attention to drug test results. Some hospitals require social workers to automatically file a report for any positive test, while other facilities first perform an assessment to determine whether a parent might be a risk to the baby. Investigations. She ate a poppy seed salad before giving birth and they took her baby away. But hospital social workers are often overworked, said Kylie Haynes, who manages a program for pregnant women with opioid use disorder at Vanderbilt University Medical Center, one of the top maternity teaching hospitals in the nation. Social workers generally have less training than doctors, so wait. We already saw, and we already saw that they said that the doctors don't have enough expertise to properly assess if the patient is on drugs because of the meds that they gave them. And now they're putting it in the hands of social workers who have even less training than the already lacking in expertise doctors. Social workers generally have even less training than doctors on drug testing and little authority to question the test results, she said. Investigating the cause of a positive drug test is not considered part of their job, but snatching your baby is. Hello, Crystal House BK. Snatching your baby is. We're not medical providers, said Haynes, a licensed social worker herself. We can't interpret drug screens. The timing of the test can also make it tricky to interpret them. In theory, the best time to take a urine sample for drug testing is when a patient arrives at the hospital before receiving medications. But it is common for hospitals to test urine samples taken from a birthing patient's catheter bag or to request a urine sample after medications have already been administered, providers said. Newborn drug tests can add another layer of complexity. While urine tests can detect potential drug use over a period of days, testing the baby's meconium can uncover illicit substances going back months. Meconium tests are widely considered to be the gold standard for newborn drug testing because they can indicate potential drug use earlier in pregnancy as a possible sign of addiction. But in some cases, there's no way to tell whether a baby's positive test was caused by medication in the hospital dispensed or a substance the mother used earlier. Nor do such tests tell providers how much or how frequently a person may have used drugs. For example, if a patient used substances in the past but stopped when realizing she was pregnant, you actually don't know, said Schiff, which is kind of a mess. Medications such as morphine or fentanyl have led to some patients to get flagged as opioid users. Ephedrine and phenylphenurine, maybe, whatever. Medications for low blood pressure that are commonly prescribed during C-sections have caused false positives for meth. The Marshall Project also found that women were questioned over positive drug tests after hospitals gave them the sedatives such as benzodiazepines or barbiturates. When women are flagged by a positive drug test or results, other aspects of their lives can quickly come under suspicion. Medical conditions or birth complications that can be associated with addiction, such as high blood pressure, a placenta that separates before birth, or a premature birth, may mistakenly be viewed as further evidence that a pregnant patient used drugs, instead of trying to figure out why such things happen. Through the lens of a positive drug test, even something as innocuous as missing some prenatal appointments becomes potential evidence that a mother is a risk to her baby. And patients who had traumatic experiences giving birth may suddenly find themselves under threat. We're going to skip down a little bit more, like I said, because this is a really long article, but there's a lot of important things in here. But I just got some things I highlighted. Okay, so let's go down a little bit more. In at least 27 states, hospitals are required by law to alert child welfare agencies about a positive test or a potential exposure to the baby. But not a single state requires hospitals to confirm the test results before reporting them. Hello? Hospitals routinely contact authorities without ordering confirmation tests or waiting to receive the results. Hi, Ms. Doc. Hi, Affordable Furniture NYC. Go to affordablefurniturenyc.com for all your furniture needs in New York City. Okay. I think they also do out of state too. Not every state explicitly requires reporting on a positive test, but many hospitals do it anyway. In 2022 alone, more than 35,000 babies were reported to child welfare authorities as substance exposed. Federal data shows, with no guarantee that the underlying test results were accurate. The system is primed for a report, said Dr. Mishka Turplin, an OBGYN in Maryland and a leading researcher on substance use disorders during pregnancy. To slow it down or to stop it takes effort, and I guess don't nobody want to put the effort in. The consequences of a faulty drug test can be especially severe for people with histories of addiction, who are less likely to be believed when they protest that the positive test was caused by a hospital medication. In this environment, a patient's word is often pitted against a single drug test, and it is up to the individual doctor, nurse, or social worker to decide whether to ferret out the truth. Okay. Lisa Gershom, a nurse in Arizona, recalled the case of a patient who, in recovery for opioid use disorder, who tested positive for fentanyl. The woman insisted that another nurse had given her the medication during labor, even though it was not listed in her hospital records. Okay, wait a minute now. See, they kind of just like ease over stuff. So you telling me they're giving you medication and they're not even writing it down? Nobody even knows that you were given this medication? You got phantom nurses walking around here just giving out meds and nobody's saying anything? Why wasn't this nurse brought up on charges? You're supposed to chart. That is like 50% of your job. 50% of your job is to take care of the patient, and 50% of your job is to chart and write down every little thing you did and every little thing the patient did. Grisham. Let me just read that sentence again. The woman insisted that another nurse had given her medication during labor, even though it was not listed in her hospital records. Grisham, the director of the hospital program for substance-exposed infants at Banner University Medical Center in Tucson, took it upon herself to investigate and eventually tracked down the nurse. And thank God, the nurse who confirmed the patient's explanation. She could have just lied and said, no, I didn't do it, and it was done. They don't have video. They don't have nothing. That she didn't chart nothing. So this is what's happening. You know, as Black people, we definitely have to pay attention to us in these hospitals. The babies, look what they're doing to the babies. Look what they doing to people, the mothers. We going through a lot in these hospitals.